A few weeks ago, I reported out on how now the government took the black box warnings off on, using estrogen, etc., hormones. Now I want to share some insights on dietary fat that just came to light and heart health. Now, the recent science is finally making it clear what I've been saying for 40 some years. After decades of the opposite message basically dominating the guidelines. Now, the conversation, medical and public health communities have urged people to switch from whole fat dairy to low fat or fat free versions, based largely on the assumption that saturated fat from dairy raises cholesterol and clogs the arteries. And that recommendation drove billions of dollars into product reformation and shaped the dietary guidelines worldwide. Now the evidence is really thin, which we always should have known as functional people. Now a brand new prospective study from the University of Minnesota School of Public Health, just published in the Journal of Nutrition, adds important new data. And basically the research was of 3,100 young adults from the CARDIA, C-A-R-D-I-A cohort. And actually they started looking at 18 to 30-year-olds old back in the 1980s for 25 years. And they tracked their dairy intake and then used CT scans to measure coronary artery calcification as their reliable marker of atherosclerotic disease. And this is what they found. People who consume the most whole fat dairy over those 25 years had 24% lower risk of detectable coronary artery calcification. 24%. Oh, that's definitely not what all the cardiologists used to tell us, right? Low fat dairy and total dairy intake show no significant relationship, neither protective nor harmful. The protective association with the whole fat dairy remained even after adjusting for age, sex, race, smoking, physical activity, and all other cardiovascular risk factors that pretty much are known. It was only modestly reduced when body weight was added to the model, suggesting the benefit is not simply because of whole fat dairy eaters happen to be thinner. This is believed to be the first long-term prospective study to directly compare whole fat versus low fat dairy intake with an objective measure of subclinical heart disease in younger, multi-ethnic populations. Now, the results align with a growing list of a large cohort studies and randomized trials showing that full-fat dairy is either neutral or associated with lower risks of heart disease, stroke, type 2 diabetes, exactly the opposite of what we were told for decades. Yet, despite the accumulating evidence, most official guidelines are still recommending low-fat, fat-free dairy, but I hope that you're not. And of course, they still are telling warnings about saturated fat. Now, we've spent more than 40 some years pushing people away from foods that new science suggests may actually protect the heart. It's time our advice catches up. I know in this functional community, we're way ahead of that curve. And that, of course, is my opinion.